of the following which is unlikely to be associated with the binding of drugs to plasma proteins? That is, plasma protein binding generally limits renal tubular secretion and biotransformation. The greater proportion of dose of a drug administered orally will be absorbed in small intestine. However, on the assumption that passive transport of the non-ionized form of drug determines its rate of absorption, which of the following compounds will be absorbed at least extent in stomach? That is propranolol with pKa 9.4. Lipid-soluble xenobiotics are commonly biotransformed by oxidation in the drug metabolizing microsomal system. For each description below, choose the component of the microsomal mixed function oxidase system with which it is most closely associated. That is NADPH, that is nicotinamide adenine dinucleotide phosphate. Possible causes of resistance to cytotoxic chemotherapy include increased repair of DNA damage. Of the following, which is unlikely to be associated with drug distribution into and out of the central nervous system? So you tell me the answer for this. And next one is, a child shows symptoms of high fever and skin eruptions. It is diagnosed as chickenpox. The drug of choice would be acyclovir. Azidothiamidine is the nomenclature for zidovudine. Zalcitabine, zidovudine, efavirenz, and indinavir are drugs recommended during an HIV infection. Which drug does not affect DNA synthesis in HIV? That is indinavir. Which of the following is a prodrug of pencyclovir? That is both famciclovir or 6-deoxy diacetyl pencyclovir. Drug of choice for typhoid is ciprofloxacin. The mechanism of action for tetracycline is that they inhibit amino acyl transfer RNA attachment to A site. Tetracyclines cause which one of the following side effects? That is Fanconi syndrome. Chloramphenicol is obtained from Streptomyces venezuelae. Dipivaprin is the prodrug of epinephrine. An example of supraadditive combination is acetylcholine and physostigmine. A person is suffering from keratoconjunctivitis caused from herpes simplex type 1 virus. He is prescribed eye drops of an antiviral drug. The drug is idozuridine. After taking this medicine, the patient may suffer from neutropenia. Next is, which of the following antibiotic causes leakage from cell membrane? That is colistin. Which of the following is a polypeptide antibiotic? That is tyrosine. Which of the following antibiotic causes discoloration of skin? Clofazimine. Which of the following drugs attacks hypnocytes and thus used in radical cure of malaria? That is quinine. An anti-vertigo agent is cinnarizine. A prokinetic drug is ondansetron. The ultralante insulin preparation is administered by subcutaneous route. Insulin receptors are tyrosine protein kinase receptors. MAO-A of sulfonylurea is provoking insulin release from beta cells. Verapamil exerts its effect by blocking L-type calcium channels. Theophylline is an example of non-selective phosphodiesterase inhibitor. The drug of choice for methicillin-resistant Staphylococcus aureus is vancomycin. Patients having a history of severe immediate reaction to penicillin have a low risk of having reaction to broad-spectrum anti-pseudomonal penicillin. Tuberculosis bacilli exist in tuberculous patient in three pools: extracellular, intracellular, and necrotic caseum. The only drug which is bactericidal for all three is isoniazid. All of the following are considered primary drugs in the current therapeutic approaches to the treatment of tuberculosis except para-aminosalicylic acid. Which of the following antitubercular drug has hyperuricemia as one of the untoward effect? That is pyrazinamide. Which of the following is a bactericidal antitubercular drug that has an inhibitory action on cell wall synthesis? That is isoniazid. Ethambutol has become a primary treatment drug in the therapy of tuberculosis because of its infrequent side effects. The only significant toxic effect is retrobulbar neuritis. Hemorrhagic cystitis is associated with cyclophosphamide. Drugs that may cause megaloblastic anemia include each of the following except thiabendazole. Which of the following drug has been used for the treatment of river blindness? That is ivermectin. Tetracyclines are not used as a first choice drugs in typhoid. Sorry, yes, right, typhoid. Which of the following antitubercular drug is used in treatment of leprosy? That is rifampicin. Reddish black discoloration of skin is the major disadvantage of clofazimine. Gray baby syndrome is the specific adverse effect of chloramphenicol which occurs in neonates due to blockage of electron transport chain by chloramphenicol. The selective toxicity of vancomycin as an antibiotic is most likely because it acts on biochemical pathway unique to bacteria. Acyclovir is deoxyguanosine analog and anti-herpes drug. The selective toxicity of okay, this has done. The most effective drug for prophylaxis against meningitis is sulfaxazole. Which one of these combination is MAO inhibitors? That is tranylcypromine, phenelzine, and isocarboxazide. Sodium nitroprusside is one of the most potent blood pressure lowering drugs. Its use is limited because of its short duration of action. Digitalis preparation are contraindicated with thiazide diuretics. Choose the correct class 4 drug antiarrhythmic that is primarily indicated for the treatment of supraventricular tachyarrhythmias. That is diltiazem. One of the following drugs, when co-administered with terfenadine, may lead to life-threatening cardiac dysarrhythmias. That is itraconazole. A drug used in Prince metal angina has spasmolytic action which increases coronary blood supply is isosorbide mononitrate. The antihypertensive action of captopril is affected by spironolactone. Which one of these is useful in peripheral vascular disease? That is isozustrine. The action of quinidine differs from that of digitalis in decreasing irritability of cardiac muscle. The enzyme that is inhibited by ecothiopate iodide is acetylcholinesterase. The non-selective beta-adrenergic blocking agent that is also competitive antagonist at alpha-1 adrenoreceptor is carvedilol. The reversible cholinesterase inhibitor indicated in the treatment of Alzheimer's disease is tacrine. Ritodrine hydrochloride is used in treatment of premature labor. All of the following drugs are used topically in the treatment of chronic wide-angle glaucoma. Which of these agents reduces intraocular pressure by decreasing the formation of aqueous humor? That is timolol. The cholinomimetic drug that is useful for treating postoperative abdominal distension and gastrictomy is bethanechol. Pralidoxime chloride is a drug that reactivates cholinesterases that have been inhibited by organophosphate cholinesterase inhibitors. Which of the following antimuscarinic drug is used by inhalation in treatment of bronchial asthma? That is ipratropium bromide. The drug of choice in the treatment of anaphylactic shock is epinephrine. Both phentolamine and prazosin are competitive antagonists at alpha-1 adrenergic receptor. Dicaumaril as an antimetabolite of vitamin K. An example of hematopoietic growth factor is erythropoietin. Tissue plasminogen activator that disperses blood clots